Good afternoon, everyone. We're just giving a minute for all of our spokespeople to join. We will be granting recording permissions. We will also be sending out the recording after this so you can have it. So just making sure that everyone's on here, and then we'll get started in a minute. We do, with everything happening and the preparations taking place, we do have a hard stop at 5 o'clock. So we'll give you an update, and then we'll try to get to as many questions as possible today. For the sake of time, I will go through. I know many of you have joined our briefings every single week for the last several weeks. We do have our spokespeople, and we have a special guest today as well. So I will go through our spokespeople right now. We will make sure to send their names, titles, spellings, all of that after the briefing. So we have Warner Thomas, our president and CEO for Ochsner Health, Dr. Robert Hart, our chief medical officer, Mike Hulefeld is our special guest, our chief operating officer for Ochsner Health, Dr. Sandra Kemmerly, system medical director of hospital quality, and Dr. Catherine Baumgarten, our medical director of infection control and prevention. So with that, I am going to turn it over to Warner for an update on how we're preparing with COVID, of course, and now with Hurricane Ida.
Thanks, Nicole, and thanks for everybody joining this afternoon. Certainly a serious situation we're dealing with here with the hurricane that'll be approaching this weekend. We've been preparing, for multiple days now, and we can certainly take you through some of that preparation. We've done this before. We constantly update our disaster preparedness plans. We have very specific approaches by campus, including how we approach our staff, how we approach supplies, backup generation, and really our complete emergency and disaster plan. From a COVID perspective, the positive news is we've continued to see decline in our COVID cases over the past week. If you go back to a week ago, August 19th, we're at 988 COVID patients. Today, we're down to 836, so that's obviously a very large decline. I would say that most of that decline is in New Orleans, but we have seen a decline in Lafayette as well, and also in the North Shore region. North Louisiana has actually ticked up a little bit. We saw a slight increase in North Louisiana. So that's a little bit on what's happening there. We just got off a call with all of our leaders over the past hour to go through our hurricane preparedness plans. How we're going to handle staffing and essential personnel when we get into a disaster like this. We bring personnel in on site, what's called our Team A personnel, and I can have Mike talk more about that. In summary, but we. Depending upon the track of the storm, we may adjust that over the weekend. But all of our supplies have been ordered. We have, I believe, Mike, it's 10 days of supplies, fuel, food, drugs, medical supplies. So we're prepared for at least 10 days. And once again, backup generation, all of that. We constantly test that. And we are prepared in that situation. So, I don't know if Nicole O'Malley, how you want to handle that. I mean, Mike, maybe you could give a real, just a really brief thumbnail view of kind of like our essential personnel, and just kind of how we're handling that, and then we'll just go right into questions.
As Warner mentioned, we planned for this in advance, and so. We have staff who volunteer to be Team A, who we do call in. We anticipate them coming in either Saturday evening or Sunday morning, depending on which market they're in. Those folks come in. We bring in enough people to care for the patients that we have, and they work 12-hour shifts. 12-hour shifts, 12 on, 12 off. Obviously, with COVID, we want to be safe but lean. and do this in a way that is safe from a patient care perspective and also safe from a COVID perspective. So we do have different things like different sleeping protocols, and all of our campuses have figured out and have the adequate space in order for our staff to be safe who are on site.
And Mike, I know as far as our clinics on Monday, in markets that we think will have more impact, we'll obviously postpone our clinic appointments on Monday. We are not making a call on surgical procedures at this point. I don't know if you just want to hit that briefly.
Yeah, as folks know, COVID has certainly impacted our ability to do surgical procedures. We've had to defer a lot, and so we will revisit that decision tomorrow as it relates to surgical cases on Monday. And again, as Warner said, there are certain parts of our organization that will be more impacted, certain parts of our organization that will be less impacted by this storm. And so a lot of these decisions that we make are done regionally and obviously in the best interest of our patients and what that community specifically needs.
I would just say overall, I got asked this question by a report earlier today that, certainly it is a stressful time, given what our teams have gone through, with the COVID-19 crisis, and certainly the fourth surge that we've been going through, having a Category 4 hurricane heading our way creates additional stress, on the team. Certainly we're very concerned about our teams. We communicate with them. All the executives here and the teams here, will be Team A will be on site and on location as we go into this storm. But I will also say that we are prepared. We plan for this. We're battle tested for these situations. Our leaders are very prepared for this, and I got to tell you that the atmosphere and the attitude is positive. We know we'll make our way through this. Whatever comes our way, we'll adjust and adapt appropriately. So yes, folks are tired. It's challenging. But at the same time, I think people will step up and do what's needed to take care of folks and make it through this challenging time. So with that, Nicole, unless there's something else you want us to cover specifically, maybe we'll stop, and unless you want to hear more stats, or just go to Q&A.
I think we can go to Q&A unless Dr. Hart, is there anything else you wanted to touch on?
I would just say that, it's challenging in the sense of, even though we've seen that COVID census come down, over 60% of those patients, COVID patients are, between 25 and 30% of those patients are in our ICUs. And of those ICU patients, upwards of 70% of those patients are on ventilators. And so still a challenge to manage those. But like Mike said, we've got the staff that comes in. We plan for this type of thing. Have had to plan for it many times in the past. So those people plan to come in and stay through the storm and be able to be here and manage those patients just as we would.
Yeah.
Thank you.
There's a question from Emily about, are we transferring patients? No, we may move a few patients around in our system. I know we looked at a couple of patients that were in, Morgan City and in our St. Charles facility. We've relocated a few patients, but as far as transferring out of the market, no, that's not our intent. We think we're in good shape to be able to take care of folks. And once again, I mean, we've hardened our facilities from a backup generation power perspective. We have plenty of fuel that we have brought in. We have portable generators that we bring in, and we can basically move to different regions based upon what the power needs are there. We have continued to make investments over the past decade and a half, in a post-Katrina environment, and even pre-Katrina, how we have enough backup power to run our facilities in a very comprehensive fashion. So we do not anticipate having to transfer patients out of the market at this time.
Warner, can you repeat again the number of people we currently have hospitalized with COVID versus a week ago?
So a week ago, we were at 988 in the system. Today, we're at 836.
Okay, thank you. Another question came in from Paul with the Advocate in Baton Rouge. Do you anticipate receiving patients from smaller coastal hospitals that may need to evacuate? Do you have room to receive additional patients?
So we've informed the state that we have limited capability to take patients from other facilities, especially nursing homes that, sometimes have to evacuate. I know that some of those have already occurred and have evacuated other sister nursing homes in those types of situations. Once again, we have been running at capacity, as based on our phone calls for a number of weeks. Not saying we wouldn't take any patients, but our ability to take a big influx would certainly be very challenging.
Okay. How many days of power could the generator supply on average?
Go ahead, Mike.
Yeah, we have continual fuel sources. And so obviously all the generators are topped off at this point, fuel being the one, potential rate limiter, but we have backup contracts to ensure that we have adequate fuel supply. So as long as we need to do it to run them, we can run them.
Okay, thank you. All right, are there any other questions for us this afternoon? And if you want to come off of mute and ask, you can do that too. Oh, follow-up question about the percentage of ICU patients on ventilators again, Dr. Hart?
Around 75%.
Okay, thank you.
Dr. Kemmerly and Dr. Bumgarner are going to be bummed out. No COVID questions today. So,
Well,
Yeah.
wait, more questions coming in. Do we have the hospitals, we currently have wells for water? Mike, do you have?
Yeah,
Or
so we
water?
do have wells drilled at multiple facilities so that we basically can run in a self-sufficient fashion, off of city water. So that's something that we had at some of our facilities, during at our Jefferson Highway campus during Katrina. Since then, we have actually drilled wells at many of our hospitals so that we can run off of city water, because we understand that the power generation and or flooding can impact our water supply. So that's something we have definitely prepared for in the past and test those water supplies on an ongoing basis. So we feel like we're in good shape there.
Great. What's from Business Insider? What's the number of ICU patients?
Robbie, you got that?
Yes, 254 across the whole system, including Lafayette. Yes.
Thank you. Are there any things that we could share on major ways that the COVID surge has had an effect on our typical hurricane preparations?
Mike,
maybe you want to talk about sleeping, that sort of thing.
Yeah, I think that's the number one issue is housing. Obviously, when we call in essential personnel, we house them, we feed them, and we provide a safe place for them. Those housing limitations are different and have to be more spread out and a little bit, again, different than how we would have historically done them in a non-COVID environment.
Okay. Janet's asking how many beds are available of a total. I'm not sure if we have that.
I don't know if we know that. And once again, we're discharging patients today. There'll be some discharged tomorrow. And, more than likely we'll have patients admitted tonight, overnight, and patients admitted tomorrow. So that really depends on a moment in time. But I don't know, Mike, if you get any more specific information, understanding that it constantly changes.
No, I think as folks again are well aware, our rate limiting step is staffing and the challenges associated with having enough people to care for the influx of patients that we've had. So the only thing I would say is we staff and open every available bed we possibly can so we can provide access to our patients and to our community.
Okay, another question came in. I know you have talked about how patients are managing COVID with oxygen at home and being directed to come back if things get worse. What are they being instructed to do if they decompensate during the storm or live somewhere they can't get to a hospital?
Yeah, so we have been communicating, with the state and with the cities that having shelters available, and oxygen at shelters and that sort of thing is an important component as we go through this. We do see typically that if folks get in trouble, they end up at an ER. Once again, our capacity is limited, but if folks come, we're going to take care of them. There's no doubt about that. But I know that the state and or the cities have been, and the parishes have been working to create shelters that have some oxygen capability. I spoke to the governor today. He knows that this is definitely a challenge out there. And I know that there's been a lot of communication from the cities and the parishes around having shelters for them. But if folks show up at our ER and they're, in a challenging situation, we're going to take care of them. So.
Right.
I think we have, Mike, I don't know if you know, I think it's thousands of people that we, in our DME, that we provide oxygen to that, or actually David Gaines, I know, David, you, from a DME perspective, we've got lots of folks, thousands of folks that we're providing oxygen to. I know we've been communicating with them in the past, 24 hours.
Yeah, that's right, Warner. And we're also supplying them with extra canisters and alternate ways to recharge. So in case power goes out, alternate charging devices too. So yeah, we're in contact with those patients.
Thank you. Okay, we have a supply question. Just knowing, with ICU and COVID patients, are there any items we're particularly concerned about being able to resupply if some hospitals are cut off for a few days?
No, I think we just had a call with our team and our supply chain leader was on. We have a kind of a set order of, many days of supply that we set that just basically that comes as part of our hurricane disaster preparedness. We made that order, I believe, Mike, yesterday. I get delivered tomorrow.
2 days ago.
2 days ago. So that order was made. Those supplies will be delivered tomorrow. We'll be in good shape. We don't have any limitations, from a supply perspective that we're worried about.
Thank you. Okay. Does anybody else have any other questions, or do any of our spokespeople, do y'all have anything else you'd want to add? I know we've talked about preparedness and just that we have a team that works on this year round. Any closing comments? Okay.
Let's hope the storm gets downgraded and it's not a category 4. How about that? We'll keep our fingers crossed on that. And once again, I think we will be in constant communication all weekend with our leaders and, the leaders of our regions, the leaders throughout our whole organization. We have constant communication throughout the organization with our team members. And once again, because it's a flexible situation, we don't know exactly which market impacts, how it's going to move. And so we'll have a rhythm throughout the entire weekend that we stay in contact with folks based upon how the storm moves, how strong it is, the timing of landfall. So we keep constant updates. Any staff resources coming in from state and federal agencies. I know we got some staffing into our Lafayette market. We had about 20 personnel that came from the U.S. Navy. Mike, are there other resources that, and there's no additional resources coming as part of the hurricane, but we had gotten some previously.
Yeah, per the question around COVID, yes, as one mentioned in Lafayette, We had federal resources at our Ochsner Medical Center in New Orleans to help us expand our monoclonal antibody treatments. And in North Louisiana at Shreveport, some state resources as well. And then we're continuing to discuss with the state additional resources in New Orleans on the North Shore. So there's been a positive response from that perspective.
Thank you. And I would say, I know that all of y'all are out there covering the storm as well. So we hope y'all stay safe covering this. We will do our best to have updates as much as we can, obviously with our teams focused on taking care of the patients that we have and our own team members. But we will do our best to give updates as well. Our next media briefing was actually already set for Tuesday morning. So, but we'll see if we can accommodate requests as needed throughout the weekend, and we'll be sure to update y'all with any closures and some information that our communities may need to know as it happens.
Yeah, and Nicole, if it would be helpful, we can work with you, and if it'd be helpful to have an update sometime during the weekend as the storm gets closer. We're all going to be here hanging out together, so we could certainly, if that would be helpful, provide that transparency about what we're seeing and how we're doing things. So maybe we can connect on that and figure out what makes sense.
Absolutely. All right.